Hi, I'm Dr. Sunanda Kane, Professor of Medicine at Mayo Clinic in Rochester, Minnesota, and I thought I would just take a few minutes to update you on a relatively recent study that came out in our literature in regard to the outcome of infants born to mothers who are on biologic agents to treat their inflammatory bowel disease. So we know that biologics, with the exception of Cimzia, cross the placenta, and there has been concern about the effect of fetal exposure to a biologic in terms of their outcomes after birth. And the newest study that actually Mayo Clinic was part of was looking at the vaccination status of little infants who get vaccines after having been exposed to biologics in utero. So it turns out that infants that have been exposed to biologics have just as good as an equal mounting of immune response to childhood vaccinations as compared to some children who have not had exposure but were born to mothers with inflammatory bowel disease. So the two that we tested were Haemophilus influenza and tetanus. And so those are two very common vaccinations given early in infancy, and it looks like in the bloodstream that the ability to convert those vaccines into protective immunity is the same whether there had been exposure to a biologic or not. And that's very encouraging because we know that biologics can decrease the immune system, and that patients who are on biologics are more at increased risk for infection themselves. However, when there has been passive exposure through the placenta, it does not appear that there is any long-lasting effect to the immune system of these children, at least in terms of them being able to convert vaccines as readily as children who are not born on biologics. So what does this mean? It means that moms who have been on biologics during pregnancy and give birth, that their children should get vaccinated, and it appears are going to have the same protection from those vaccines as children who have not been exposed to biologics.